President and CEO of Ledrock Consulting.
And I'm Jody Ashley. I'm Director of Client Services.
We are very excited to be able to bring you a new program called From Their Perspective. Each month, you're going to have the opportunity to listen in on interviews with some of today's leaders in the healthcare industry. We're going to be able to bring you some CEOs, some presidents, a couple vice presidents. We're going to be looking at operations for all of the systems, assisted living, skilled, CCRCs, all of those systems. And we're going to bring you some marketing folks as well, some directors of marketing and some business development.
And today it's with great pleasure that I introduce Zach Shamberg, who is the President and CEO of Pennsylvania Healthcare Association.
So welcome, Zach.
Thank you so much for having me.
Well, we're thrilled to have you. And before I start actually with the questions, I wanted to make sure that I congratulated you on the job you're doing at Pennsylvania Healthcare. I've been able to observe it over quite a few years, and you've really done a terrific job in helping. I think the state associations are absolutely critical to the communication that we need to have so we know what's going on, and you've really been able to do a great job with that. So we thank you.
No, I really appreciate that, and it's my honor, and believe me, it's not just me, it's my team here in Harrisburg, and I agree with you, Ronnie. I mean, it's never been more important for a state association like ours to act as the conduit between our officials in state government here in Harrisburg and our providers on the front lines to communicate, to share what's happening, to share recommendations. So again, it really is, and it has been our honor this past year.
Good. Well, we certainly have had a very eventful year. We've dealt with a tumultuous election, the pandemic, and all of that on top of what all of our team members have to deal with every day. So because of that, we thought we might ask you to think back a little bit and kind of give us an idea from your perspective. What do you think have been the greatest changes in the past 5 years?
Yeah, it's a great question, you know, and I can think about a couple different things. I mean, one is obviously our aging population here in Pennsylvania. And in the past 5 years, we've gotten to the point now where our fastest growing demographic is those 85 years of age and older. We're about 3 to 5 years away now from when the baby boomers will age into the demographic most in need of long-term care. And Pennsylvania, as a state, is the third oldest in terms of our population in the entire country. So I look at that, and there's certainly been in the last 5 years a real emphasis on long-term care issues. Now, you have the boom with those who have Alzheimer's and dementia, and that includes my grandfather, and the idea or the struggle with how to care for that population. You've got a workforce crisis that over the past 5 years has really reared its ugly head, and it has providers, especially right now, asking how will we care for this aging population moving forward with a shortage of LPNs, CNAs, RNs, you name the position. But really, when we think about how things have changed, I have to focus on these last 11 months. And COVID-19 has certainly changed every facet of the world around us, but no more or no group has been more adversely impacted than our vulnerable seniors in long-term care and our men and women on the front lines who have cared for them each and every day. That's going to affect everything that we do moving forward. It's going to change everything in terms of how we operate and what we're able to do moving forward. I think it's also cast a spotlight on this sector in a good way, that we have regulators and legislators and the general public finally acknowledging the work that our caregivers do and the things that our vulnerable residents need. So I'm hopeful that we'll be able to utilize that momentum moving forward and get real support to these providers.
Cool. In listening to your view, your vision of what's occurred, I'm just wondering, and I agree with you 100%. I think COVID has changed a lot of the way we actually look at things we've done every single day. But how do you see that impacting the future of our industry?
Yeah, I look at where COVID-19 has impacted our industry the most. Again, we were dealing with a pre-existing workforce crisis. And what is that going to mean moving forward? Because as we talk to staff every day, even now, 11 months in, what we're hearing, Ronnie, are stories of fatigue and exhaustion and burnout. What is that going to mean for our workforce when this is all said and done? What is it going to mean in terms of how we operate for visitation and reuniting our family members or reuniting our residents with their family members moving forward? How will COVID impact that? How will it impact our use of personal protective equipment? And I think most importantly, as I stated before, the spotlight is on long-term care now. It's on providers, it's on workers, it's on residents, and it's on what they need to be successful moving forward. So I'm hopeful that this year, our regulatory agencies, our legislature, and the general public will fight together for a real investment in this sector, in this industry, in these providers, whether it's an investment in the state's Medicaid program, Medicare at the federal level, whether it's liability protections for these providers so they don't have to face frivolous lawsuits moving forward, or if it's just the support that they need for equipment, for testing, and for things moving forward that are going to protect their residents. I'm hopeful that that will be the change that we see. I'm choosing to be optimistic about it.
Okay. Zach, go back to what you said about, excuse me, we have pre-existing issues in the workforce. I have a daughter who's a social worker, and she is in a skilled nursing. And the question I have for you is, she didn't grow up saying, I always wanted to work in skilled nursing. They just end up there. What do you think is going to happen, or how do you think our communities will attract these younger people who want to be a nurse, who want to be a social worker, but didn't grow up saying, I want to go into skilled nursing? Great question.
Yeah, I did, by the way. I grew up always saying that.
Okay.
I was gonna be in this business. Now, I agree with you 100%. Not many people do. And unfortunately, when you think about going into a career in healthcare, you think of hospitals, you think of an emergency room, right? You don't necessarily think of long-term care. I think what we need to do is work with the state, work with local chambers of commerce to ensure that younger Pennsylvanians know about these careers, work with school boards and work with our education system so that we are educating Pennsylvanians in middle school and in high school about these careers. I said it earlier that we're the third oldest state in terms of our population in the entire country. And the demographics are trending to that we're going to need more and more caregivers to care for our seniors and for our baby boomers. These are jobs, these are careers that are going to be around for the foreseeable future, for 5, 10, 15, 20 years. And we should be investing now. We should be talking to younger Pennsylvanians now about these careers and the benefits of going into this industry. One other thing I'll point out is that during the pandemic, what we did in Pennsylvania was create a new role called the temporary nurse aide, or TNA. And basically, it allowed any Pennsylvanian who was looking for a job, who had been laid off or was out of work, to take an online training and then go to a nursing home and help, be on the front lines and aid CNAs, LPNs, RNs with activities of daily living and things like that. And it gave folks a window into our industry to see, hey, this is something that I could see myself doing. We need to find more opportunities like that to bring folks in so that they understand how this industry works and they can see if it's right for them. Because not only are we having a challenge with attracting folks to this industry, but retaining, as you know, is a big issue. That turnover is so high, we can't keep people in the same position. Temporary nurse aid program allowed them to look inside and see what this is like and see if it was for them.
So are they able to be a temporary nurse assistant without certification?
Yes, without certification, they are until the end of the disaster declaration. Now, we got a bill passed here in Pennsylvania that would allow those temporary nurse aides to get on a track and be eligible with on-site training to be CNAs. So again, it puts them on the path to full-time employment so that we can keep that workforce pipeline flowing. It was a really, really great victory for this industry last year.
Right. One of the things that I found in all the 30 years that I've been doing this is that about every 2 years, something changes in our industry, whether you go all the way back to the days when DRGs came in, and then, you had rehab changes, and about every couple of years, there's something big that happens. So I'm wondering if you want to look forward a little bit and tell me what you think will be the next big change that we have to face.
That's a great question. I would actually first look back at about 2 to 3 years ago when managed care came into Pennsylvania, and you're starting to see managed care go into other states. And that's the way that long-term care is going to operate, not necessarily a provider interacting directly with the Department of Health, but putting essentially a middleman in between a managed care organization, and that's how care will be paid for. I'm wondering how sustainable that system is moving forward. I'm wondering if that's how we're going to continue to conduct business in Pennsylvania. And we've seen in other states that hasn't necessarily held up in the last 5 to 7 years. So it will be interesting to see if that's going to be utilized moving forward. I would also say that, we're going to have to, post COVID-19, look again at Medicare, at the Medicaid system, and determine, is this really the best way to reimburse providers for care? Because the system, certainly the Medicaid system, has not kept up with rising healthcare costs each and every year. And it's really left providers nowhere to turn. And that affects everything they do: recruiting and retaining staff, investing in care, investing in their facilities. It affects every facet of caring for our most vulnerable. And we may need to look again at a system like that to say, is this really the best way to provide care and to reimburse for care moving forward? But that remains to be seen.
Right. That's huge. What about hospitals? Do you have any thoughts about what's going on with the hospitals as they begin to kind of pull together into these huge organizations? And will that have an impact on our healthcare, our post-acute hospital healthcare?
Right. So you're seeing a lot of hospital mergers. And what's interesting, it's hard for me to speak to, will that have a direct impact on long-term care? But what's interesting is we're seeing, I think, a similar trend with our long-term care organizations. And I look at this sector specifically in Pennsylvania, what it was when I came into the business and came into PHCA in 2014 to what it is now. And we're starting to see that the same companies are owning 20, 30, 40, even 50 or 60 buildings. And we're starting to see those mergers as well. So what's going to happen when in Pennsylvania we have 2 hospital systems and 3 long-term care companies with very little competition? That's worrisome to me, that the local tried and true Pennsylvania providers are leaving, and we've got a lot of the larger out-of-state conglomerates coming in. That's concerning, and it remains to be seen what that will mean for care, but it's certainly something that we've watched very closely over the last couple of years.
Mm-hmm. That we want to keep an eye on.
Yeah, definitely.
So let's see if we can shift gears a little bit now, because all that was extremely valuable information, hopefully for our listeners as well. But in the once the pandemic is over, once we've been able to put this behind us, occupancy, revenue, and census are going to be critical especially for the mom and pops and the smaller companies. So I wondered if I could ask you, what do you look for? What do you think our leaders should look for as the number one attribute that you want the person that runs your sales department to possess?
So, and just so I'm clear, when you're talking about a salesperson for one of our members who are actively recruiting for someone to come in.
Correct.
Well, I think it's getting the public trust back. After all that's been done and after all that's happened these last 11 months in long-term care, and that's nursing homes, personal care, and assisted living, where we've essentially shut down all visitation. And again, I can tell you from a personal perspective, my grandfather who's in a personal care home, the only time that we've been able to see him is through a window over the last 11 months. In a sales position for long-term care now, you've got to renew that trust between a potential resident or their family member and your facility or your operation. And I think it's instilling in them and instilling in the general public that we are a safe place to come. We provide high quality care. We're going to be able to facilitate visitation. We're going to be able to hopefully continue to vaccinate moving forward. I think those are the most important things that we can say, especially to your point, Ronnie, as we're seeing census at an all-time low, as we're seeing occupancy dip. Our industry needs to be out there in the public saying, we are safe again, and here's why you should come back.
Right. And a great message. And I agree with you. Let me just push a little bit further and say, what is it you're looking for in that person that you're going to hire to come in and do just what you said? What is the number one attribute you think that person must possess?
An understanding of all that's happened and an understanding of what the future will look like. I mean, you've just asked me a few questions about what I can foresee into the future. And that's hard right now, especially as we're still in the midst of COVID. But someone who can come in that sales role, really understand where we've been, but also where we're going, and to alleviate concerns of family members or of potential residents. I think that's going to be really, really important moving forward.
Okay, great answer. Now I want to talk a little bit about you. Because we've watched you grow in this position and really become very successful in our industry. So I want to ask you if you could think for a minute and share with us, what was the best professional advice you've ever received?
Well, first of all, thank you for the compliment. And again, I can't take credit for what PHCA has done this past year, because it's our team here in Harrisburg, and it's really the members that we represent. We have no leg to stand on if we don't have high quality providers every day doing all that they can to protect their residents and staff. But for me, I've had some pretty incredible mentors in my life, including our last two presidents here at PHCA, both Stuart Shapiro and Russ McDade, who've taught me a lot about this industry. They've connected me with a lot of providers. And I think the best advice that I've received from them and from the providers is, again, to gain that understanding of what you're selling or what you're advocating for, to walk a day in the shoes of a CNA or an LPN or an RN. When I first came into this position in 2014, one of the first things that Stuart Shapiro, who is in my role now, told me was to spend a few days in a nursing home, understand the challenges, understand what they're dealing with. And only then are you going to be able to really communicate to the legislature, to the regulatory agencies, to the general public, what this industry needs. And that was the best advice. Anybody can come into a position and advocate for something or advocate for legislation. But until you've really lived the day in the shoes of some of our providers and what they've experienced, you're not going to be able to talk about it. You're not going to be able to really sell it. And that has always been beneficial to me. And I utilize that now whenever we're undertaking a new initiative, whenever we're trying to get something accomplished. I think about, what will that mean for an administrator, for an executive director? Why is this important to them? That makes my job a lot easier.
So when you were in that nursing home, Zach, what would you say was the most eye-opening thing that you saw or that you walked away with that had you not spent the day there, you wouldn't have thought about?
It's not just a job for our members. It's not just a 9 to 5 occupation. You really have to love what you do. I've seen it, I saw it in 2014 when I spent a few days in nursing homes. I see it now with those who are caring for my grandfather. There's a bond, there's real compassion, there's real love. And that's so important to the residents that we're serving. It's so important to this industry. It's important to a family member like me, so that I know my grandfather is being taken care of and is truly loved where he is if we can't be with him. That was really eye-opening. You can go to a lot of different professions and see that folks are there 9 to 5 and they go home and that's their day. Not for our caregivers, not for our members. This is their lives. This is what they want to do. This is what they love to do. And that was very, very informative for me.
Yeah, they're there in snowstorms and
yes,
any kind of challenges. I mean, I started my career as the director of admissions in Williamsport, Pennsylvania. And I can remember being amazed that some of the people that were there in the dietary department, in the nursing department, they'd been there for 20 years. This was a career for them and they loved being there every single day. So yeah, that's a really, really important point.
That's exactly right. And to your point, I mean, I think it's important to note both my mom and my stepfather have worked for one of our members for 20 plus years each. And I grew up in this business, though I never really understood it until I took this position. We used to talk about it at the dinner table and we'd move to the next subject, but now I've obviously really grown to love it. And I remember the stories that, my mom was up in the morning picking up people to go to work. So was my stepfather.
Yeah.
There's no such thing as a day off here. We're communicating virtually and we've moved to a virtual world during the COVID-19 pandemic. Not so for long-term care providers. They're still there every day.
Right.
They haven't shut down. They're still working. They're still caring for the residents. And that really shined through for me even back in 2014.
Cool. All right, I've got one more question. One last question. So I'm very interested in how I know you're very successful and you're doing a great job at it, but I would like to know from your perspective, how do you describe success? And what do you think it takes to get there?
Yep. So in our position as an advocacy organization, it would be easy to say that success is getting a bill passed or defeating legislation that would be harmful or getting a regulation through. But as I define success here, sometimes it's just getting our message out there and ensuring that even if the ultimate goal isn't achieved, that there's been a level of understanding from those who didn't understand before what this industry is going through. What are the trials, what are the tribulations, and what do we need moving forward? From my standpoint, and it's probably different from other folks that you're speaking with or you've spoken to, but sometimes legislative initiatives can take many years. Sometimes it's 10 years before a big bill or piece of legislation gets done. And sometimes it's just gaining that understanding. So I measure success by how we communicate our message and what the follow-up is from those folks who didn't know about it before, that I hear from them, whether, again, it's members of the legislature or the general public or our regulatory agencies who say to me, you know what, we may have not gotten it across the finish line, but we understand now. And we're going to be with you moving forward. And we're going to ensure that your caregivers and your residents are taken care of and supported moving forward. And I think that's really, really important for everything that we do here at PHCA.
Great. Jody, any other questions?
No, you have been a fabulous guest. We thank you so much.
Yep. I thank you very much, and we wish you the much more success and good health and be safe. And I'm going to turn it back to you.
Okay. Again, thank you so much, Zach. And for all of our viewers, I hope you will tune in the next time when we have Jennifer Steiner, who is coming to us from California. Jennifer is the CEO of Elsana, which is a eating recovery community.
And we're very excited to bring you people from all different realms of healthcare. So please check us out on Facebook, LinkedIn, Twitter, and don't forget our website so you can make sure you're up to date on the very next interview. Again, thanks, Zach.
Thank you.
Have a wonderful day.
Okay.